This podcast is for educational purposes only, does not constitute legal advice, and does not create an attorney-client relationship. If you need legal assistance about a legal problem, contact an attorney.
If you're a nurse, chances are that you have had a really tough time over the past few years. The post-COVID healthcare industry is almost entirely different from what it was before, and with that comes the need for immense support within the healthcare field. But where can nurses especially find this type of support? I'm Simone Murphy, and this is Know Your Regulator. Today, we're going to put the spotlight on a program that can provide exactly that support for you. It's called the Texas Peer Assistance Program for Nurses, or TPAPN, and it's specifically designed to assist nurses in Texas with the heavy challenges that they're facing today. I'm joined by Program Director Brittney Majefski, who's going to pull back that curtain and walk us through what the program is, how it functions, and maybe put some common misconceptions to rest. Brittney, thank you so much for joining me.
Yeah, thank you so much for having me, Simone. Happy to be here.
Absolutely. I'm happy to have you here. So let's kick this off. Can you tell us a little bit about the program and what is really the goal for nurses who enter into this program?
Yeah, so, TPAPN's entire purpose is to help nurses through monitoring go through, safe recovery so that overall they get to stay in the profession and continue to practice nursing safely.
Yeah.
Um, And so that's really our biggest goal is to ensure that we're also, person-centered and offering that individualization to that recovery. And the monitoring part of it is we are considered the alternative to discipline program for
Yeah.
the state of Texas. And so we're a referral-based program. And if the nurses that enter into the program, we set them up with a, person-centered, individualized therapeutic program so that as they go throughout their recovery, they can also have the evidence, the support, and the accountability that they need to effectively continue in the nursing profession.
Yeah, no, and that sounds so important. It sounds like there's a little bit of rehabilitation in there, like you said, that alternative to discipline. You're not just writing off a license holder in potentially just a really rough patch in their life. And it sounds like it's really focused on maintaining safety all around, right? Safety for the nurses, safety for their patients, but ultimately with that goal of keeping them in the profession. That's awesome.
Absolutely.
Let's talk about how does a nurse end up in like referred? I know you said that there were referrals, but how do they get referred or how would a nurse, find themselves entered into this program?
Yeah, so there's a few different ways in which a nurse can be referred to our program. And typically we see the referrals and the rationale behind why you would enter into a peer assistance or alternative discipline program. It would be related to, potential impairment or concern with a substance use disorder or other mental health condition. Actually, one of the things that is a common misnomer people, kind of get wrong about TPAP, and because we have been around since 1987, is that we only serve nurses that have a substance use disorder. We have a variety of different track placements that also include mental health. But to get back to your question, Simone, about referrals, how do you get engaged? What does that look like? So the referral is you can go onto our website. We are a voluntary program. And so you would fill out that referral, and essentially anyone can fill that referral form out. The,
Hmm,
yeah,
it's good to know.
we highly encourage self-referrals because one of the best indicators of good outcomes is that early intervention. So, when we're talking about recovery from substance use or other mental health conditions, trying to, get in that education and early intervention and inform nurses that there is a source and you can refer yourself to the program is what we really like to see. It shows that that nurse is really ready. There's accountability there within themselves, but also we have a bit more autonomy
Hmm.
when a nurse self-refers. It is a confidential program, and what I mean by that is when somebody is referred to the program, the referral source themselves, that information is kept confidential if it is not a self-referral, we are not allowed legally to identify that referral source
Hmm.
to the individual that's referred. So referrals come in a variety of fashion. Like I said, essentially anyone can refer. Um, but the self-referral is something that we do encourage early and often, and that way we can work with that nurse and potentially not even have to engage with the board of nursing if a nurse self-refers. To the program, they go through, they're adherent to their monitoring agreement. We have no obligation to refer them or contact the board of nursing in that way.
And
Uh,
I'm sure that's huge for tons of nurses to know, is that, and
yeah.
that's what they're trying to avoid is that, issues with the Board of Nursing.
Right, right. And we do have a very collaborative relationship with the Board of Nursing, of course. We are contracted with them, but what that means is typically any other form of referral that is not a referral directly from the Board of Nursing is called a third party referral. So that means a peer, a employer, someone that a patient, those kinds of referrals that we get. We do have an obligation to request from the board that we're allowed to continue to monitor that nurse or offer them a participation in our program. And it's really, as a nurse of going on, I'm trying to think, like 13, yes, going on 13, almost 14 years. It was really when I started this work to see the support actually that from the Board of Nursing, specifically for nurses that are struggling with substance use or mental health condition, giving them the opportunity to enter into our program was really, really great to see.
Yeah, support can be so valuable to license holders, and it's good for them to hear that
Yeah,
um, that they're on their side because typically we see on the defense side a lot of, people feeling like the board is out to get them or they
yeah,
feel very targeted. They feel like the board is very biased in some cases. And so I think
sure.
that's really good for nurses to hear that this is a um, collaborative program focused on making you, the nurse, the best, most successful nurse that you can be. And
Absolutely. Yeah.
it sounds like there's a lot of different ways that you can be referred to TPAPN, and really interesting that you guys you aren't allowed to disclose who the for lack of a better word, complainant or reporter is.
Yeah. So, and that is always something that's interesting, and that can be a challenge, for
Right.
someone who feels they were referred and they want to know, what's going on. You can tell them the information around that referral, but yes, that referral source is kept confidential. When I'm talking to employers or other nurses kind of about this work, I still am a huge advocate, though, if at all possible, having that conversation. If you're concerned, whether it's about yourself or another nurse that you work with, somebody that you employ, it's always best to try to have that conversation with that nurse and let them know
Right.
that, hey, because of this, we're concerned about impairment, or there has been impairment, there is legitimate, evidence of such. We're going to go ahead and refer you. And so that it's not a surprise to them. And so that
Hmm.
it does decrease some of that fear around a time in their life that might be very stressful.
Yeah.
And because the other kinds of referrals that I didn't necessarily mention are we do get direct referrals from the Board of Nursing. Offering nurses an opportunity that may have been reported to the board first versus referred to us. And then the last kind would be an actual board order. So that's typically, the board has gone through, like you said, the investigation process. And for one reason or another, they've gone ahead and put those nurses on board orders to complete the program.
Yeah, and that's where you guys would definitely be collaborating together and kind of working and monitoring the nurse. Yeah, that makes sense. Are there any instances in which someone is referred to the program and it's determined that they don't need to complete the program, or that they don't have any sort of issue going on that would prevent them from being able to nurse competently?
Yeah, so because we are a voluntary program, as a rule, we do not investigate referrals, and so that's something that is often misunderstood too. If we get a referral and they are essentially eligible for the program, and there's a few things that I can discuss that would require Board of Nursing intervention and where a nurse would not be eligible without further communication with the board, but typically if we receive that referral, that nurse is going to be offered an opportunity for TPAPN. There are times, like, to be real, of course, there are times, unfortunately, where we hear from nursing that this referral, is either not true, is done out of, unfortunately, retaliation,
Mm-hmm.
and those kinds of incidents. And so it really is, and that's where we have that conversation and say, hey, at this level, especially if it's something like a third party referral, that's coming from, let's say a spouse or an ex-spouse that, that the nurse feels like this was done in,
Yeah. Like
not
you
in
said, maliciously or in
maliciously.
retaliation.
Yeah.
Yeah.
We let that nurse know, hey, this is absolutely voluntary at this point. If that's the case, then you do not have to follow through with, participating in the program.
Yeah.
And so at that point, they can elect to, just say, hey, we're not going to participate. One of the things to know is, by Texas law, we do have an obligation for all third-party referrals. We do have to close those and send those to the board. But I always suggest, if that happens, because that's right, that's anxiety provoking.
Yeah.
Um, I would love to say that that never happens, or a nurse that doesn't meet the criteria. But I always say it's best, hey, contact the board and just let them know, hey, this is coming your way, and there's no, this is the
There's
that
no
up. There's no
legitimacy or
legitimacy,
yeah,
yeah,
yeah.
to this referral. And
That makes
that's
sense.
that's kind of that's what happens. But yeah, I think one of the things that's really important for people to know is that we don't, at TPAPN, we have a responsibility in our contract. We have to offer it to any
Mm-hmm.
nurse, and so we let them know that it is voluntary. But it can be scary when you get that letter. I
Totally.
mean, absolutely, that's terrifying because there is so much, nuance, right? And that's why we're here trying to explain kind of how that works. So if there's a letter, please call us, and please know that everyone, I have such an amazing team that I get to work with, and all of our case managers are really here because they have this passion and this desire to help nurses. So
That's
hopefully
great.
that
I
answers your
think
question.
a
Yeah.
lot of people feel like the board or even, assistance programs like this will bite them, or they're scared
Yeah.
to reveal certain things because they feel like people are taking notes and they're going to like put two and two together, put this in your file or something like that. So it's great to know that. I know that was one of the first things that you said to me was that you were like, the team here is so amazing
They are.
that, they're so passionate about what they do. So that's fantastic.
They are.
So let's talk about participation in the program because I know that there's probably a lot of things that happen. There's a long, maybe road, so to speak, to kind of completing this program and getting back to nursing without monitoring. So once someone is accepted into the program, what does that kind of day to day look like? And I'm sure that each case is kind of different, but generally for nurses, what's expected of them when they participate in the program?
Yeah, that's such a great question because you're right. And as we have evolved, just like with healthcare, right, since being in 1987, the program itself has evolved immensely. It did used to be much more of kind of like this cookie cutter idea of, you get in a monitoring program, you're going to be there for 5 years and this is what you're going to do, right? But we have worked really hard to evolve it and individualize it. But for the most part, when you come into the program, the first thing you're going to have to do is, usually if there is a concern as it relates to substance use or any sort of impairment, we're going to get a baseline toxicology test. So that's a very normal thing. It's nothing to be scared of, but just kind of that baseline, just like we do in other healthcare. We want to see where the baseline is. Are you coming in? Are you in good recovery? Is somebody maybe not in recovery yet, and so it gives us an idea of where we're starting, so that we can put together a really well developed individualized monitoring plan for them. The next step is everyone that enters into the program will have a psychological evaluation. And through that and evidence based assessments and testing, that's how we build that individualized monitoring plan. They can choose we have a list of evaluators that are familiar with the work that we do as it relates to nursing practice and all of that. And so they can choose who they go to for that.
That's
Um,
nice.
and then, yeah, through that, the goal is to balance that support with accountability. So typical things that you may see in any given um, placement would be, toxicology testing if it's warranted, if it's around substance use disorder, some sort of requirement for treatment, whether that be inpatient treatment, outpatient therapy, medication management, those kinds of things that are going to help support the overall recovery goals of that individual. And are typically some form, we work very collaboratively with employers because there may be some worksite restrictions. So, and we may request some supportive oversight. So when that nurse goes back to work, our goal is to get them back to work and collaborate more with employers and let employers know our nurses are incredible, and monitoring a monitored nurse is a safe nurse. We have so many safeguards because when they're in monitoring, there's so much, from a kind of that holistic viewpoint of recovery that they're doing to help ensure, not just their nursing practice, but their own well-being. And so those kinds of restrictions could look like, and I like to call them supportive programming, and where we may limit the amount of hours, so decrease the amount of overtime.
Mm-hmm.
Depending on where they're working, there may be some limitations as to certain areas that, maybe the first 6 months to a year in monitoring, they don't work. We do have, like narcotic type restrictions if there was a diversion concern or other substance use concerns. But all of this kind of works together. And one of the things that the program has worked really hard over the last few years to put in place is essentially called an earned advocacy program. So as they go throughout the program, it varies from 1 year to 5 years, depending on, what the nurse is here for and what their needs are. Some of those restrictions or things that we put in place for safety will be peeled back because that nurse has earned that advocacy and shown, whether it's they're showing the board of nursing or themselves that, hey, I'm in good recovery, I'm doing a great job, and we honor that and celebrate that with them.
That's awesome because I'm sure that it can sometimes feel like just a lot of stress, just kind of like a big mountain that you're climbing, and to get to the top seems kind of far. So that's great that you guys have some extra added hype, I guess,
Yeah.
around the recovery aspect of it and just kind of reaching new heights within your career, you know?
Yeah, I would be remiss, Simone, if I didn't talk about, the reason we're called peer support is because one of the most positive impacts on outcomes that we offer are our nurse volunteers. So we really celebrate the idea of nurses helping nurses. And through that, we have peer support partners. And so that's another thing that oftentimes our participants will get the opportunity to have that peer support partner. And that is someone that is in the nursing profession that understands the stressors and things that, the risk factors that may have led to a nurse, having either substance use or a mental health concern or any sort of impairment. And those peer support partners, it is a trust-based relationship. We give them information and education on, substance use and person-centered care, motivational interviewing. But other than that, it is not something like our case managers are asking for a report back from that peer support
Yeah.
partner. The goal is just they're there as a support for the nurse in the program.
It really sounds like there can be a lot kind of happening at one time when you're entered into the program, but that you guys offer a lot of support and a lot of resources and opportunities, for nurses to have help Would you say that there are a lot of common misconceptions in the program?
Yes, there are
Yeah,
often, yes, a lot of common misconceptions. And also because the program has been around for so long, there's a lot of misinformation out there
right.
around kind of the way in which it's structured, just because it has continued to evolve. Yeah.
Yeah. Where are you guys seeing that nurses are having the most trouble complying? I know that there are tons of, like you said, misinformation, common
Yeah.
misconceptions. Is that affecting a nurse's ability to complete the program?
Absolutely. I think that, a couple things here are really important is to understand, the voluntary nature in which TPAPN is set up. And so we don't actually have any authority over a nurse's license other
Yeah.
than, if a nurse is board ordered here and, unfortunately there's something that happens and there's non-adherence, we have to close that back to the board. But we can't go in and, you know, take your we don't want to do that. Our whole
Yeah.
goal is for nurses to stay in practice. But I think some of the biggest challenges that our nurses face, one of the biggest ones is employer acceptance and the stigma that exists still as it relates to substance use and mental health conditions, specifically in the healthcare professions. One of the biggest things that we do is try to go out there and do outreach so that employers understand, our nurses, and I say this, are working so incredibly hard. Monitoring is not easy. I'm going to be
Yeah.
real, right? Monitoring is not easy. And with it comes a lot of, a lot of potential stress, and we want to alleviate that by sharing the truth about what substance use disorder and mental health are, and what it is not, that it's not this moral
Yeah.
failing, it's not this choice. And so trying to combat the stigma that exists, I think is really challenging for our nurses from that standpoint of the guilt that they often feel because of that stigma. And employers, I am please, if you are an employer listening to this and have questions about how to support a nurse that may be going through a monitoring program, please call us. We want to help walk you through this. I was one of those employers, and as a psych nurse, I called and our case managers walked me through so beautifully how to support a nurse in monitoring that it made me want to work here, right? So I think,
Yeah.
for our participants, um, that beginning is really hard because there's a lot going on. There's a lot being asked of them. You know, please ask questions along the way. We're here to answer those questions. We know it can be a lot just kind of getting into that flow of what it looks like to be in a monitoring program, and going and working on ourselves is the hardest thing that
Yeah.
we can do. Um,
Totally. Absolutely.
so yeah, I think, getting that acceptance within the profession and ensuring their employers are supportive is one of the biggest challenges.
Yeah, no, and that makes sense. I can definitely see that. We all know the stigma around things, and so it's disheartening though to hear that that can affect a, a license holder, a nurse,
Yeah.
especially so much. And I want to go back to something you said. You said that if it is ordered, by the Board of Nursing that they need to be monitored,
Mhm.
um, that sometimes you have to close that up and send it back to the board. If
Yeah.
it is a voluntary referral, say I'm a self referral and I choose to not comply with the program, what happens? Do you guys just kind of close it and that's that? Or does that also get reported to the board, even though the board didn't necessarily order it for me?
Yeah, so that's such a good question, Simone. So with our self-referrals, oftentimes say that somebody, self-refers and then they later decide pretty quickly, oh, I'm just gonna do this on my own. As long as there is not a noted practice concern. So if there is not a practice concern, then we're not obligated to close that to the board. The
Yeah.
only time I think that would be something, that we are also just as license holders ourselves, as well as obligated to let the board know. Let's say that you're a self referral and you're doing you're in the program, and at your work site, there was a practice concern and you elected to not continue to adhere to the program. That would be very different than
Hmm.
if you self-refer and I should really clarify, we are a recovery friendly program. And what I mean by that is just because you have, say you're a self-referral and you're not yet in recovery and you have a lapse or a relapse, we understand that that's part of substance use disorder. So that's not
Yeah.
necessarily going to say that's not adherence. Not adherence would be something where you're working, you have a lapse, and we ask that you refrain from practice until we can get you reassessed, and you don't refrain from practice, or there's and it's usually a graded system where there's a lot of variation and chances that
Right.
you're offered as an opportunity to try to rectify that and get back in your positive recovery state.
Yeah, no, I was just real curious about that. I mean, well, obviously the consequences of, a board ordered monitoring and then you not following that and you go back to the board, you're going to get disciplined by the board. But I was real curious as to those who maybe, like you said, like were maybe felt like they had sort of an issue or maybe felt like they were going to relapse or something
Yeah.
um that they're not going to potentially get themselves in trouble. And I'm sure that's good for
Yeah,
nurses to hear too, is that
absolutely.
there is confidentiality within the program. It sounds like a lot of
Yes,
confidentiality. And so that can really ease your anxiety when you're just going through a situation like this. Absolutely.
absolutely. Yep. Right.
So we know we've talked about a little bit of some of the resources that TPAPN offers. You guys are definitely not leaving license holders high and dry without support. But going back to the overall goal and the mission of the program, what if a nurse is maybe not so sure that they would like to refer themselves into the program? Maybe they're just kind of dipping their toes in the TPAPN water. What kind of support or information is available for those types of nurses who are just kind of interested in learning what TPAPN has to offer?
Yeah, I love that question because we often get those questions, right? We'll get cold calls to like, hey, is this an appropriate TPAP and referral, or
Hmm.
is there something else first? So I often say really only the individual can truly make that decision. But with
Yeah.
monitoring, we do have quite a few resources available on our website, and you can cold call us. I promise you, we're not sitting there writing down your number and just ask in general, like, what would this look like for me, or do you think that this is appropriate? Let's say that somebody is recently diagnosed with a mental health condition, and it's related to an event. Unfortunately, nurses have a high risk. We have a lot of risk factors for a lot of these things, including substance use disorder. And so, say that somebody is recently diagnosed with a mental health condition and they're not sure, does that mean that I need to go to TPAPN or otherwise? Really, this is, to help that long term support and those long term recoveries. So, there's a lot. I always suggest know what your hospital, know what your place of employment, whether that's, in academia, whether that's hospital, residential, those kind of things. What does your place of employment offer in terms of overall wellness? So is it an employee assistance program that may be more appropriate? You just need, some medication management. And once you get that med management, you might feel a lot more stable. Is there resources? Some of our programs in the state are opening up, wellness initiatives and even peer support within their hospital system. So I always say the best thing you can do is kind of do that self check-in, and what is it? Where are you at? What do you need? Whether it be NAMI is a phenomenal resource, just the National Alliance for Mental Illness, going on there, finding different, groups, those kinds of things. And TPAPN has links to a lot of these things, from, the SAMHSA to NAMI to HHSC, and a lot of the different services that are out there for nurses that are not necessarily to the point of, monitoring or the alternative to discipline. But if you do need that long-term support, if there has been a concern in practice, or you feel as somebody like, I feel, like this is about to potentially impair my practice, that's where we come in, so that it's not only there to, show the nurse that you can do this and you're in good recovery. But there may be, the secondary factor is that you're also able to have that objective documentation through monitoring to show whether it be the board of nursing, your employment. But absolutely, to to kind of come back around to your question, is
Mhm.
there's a lot of resources out there for nurses that may
Yeah.
have, maybe struggling with mental health conditions, that we would also help support and guide them to, outside of, necessarily an alternative discipline or monitoring program, for sure.
Yeah. And you guys have a podcast as well, too, right?
We do. We just started a podcast. It's called Mental Health Mixtape. We're really excited about it. Had our first, we have one recording. We have another one coming up in February. Would love to see you guys go take a listen, give us feedback. We love hearing it, as well as a ton of other options on social media where we're trying to get, updated information out to everyone. So check it out.
And we'll have all of those linked below in our description so that license holders, nurses can easily find them. I feel like we are specifically talking about nurses, but some of this kind
Yes.
of spans beyond just the nursing profession and into those other high stakes professions alike nursing. And I think really it goes back to exactly how you answered it in the beginning, which was it's really up to the individual, right? Like there has to be some sort of self awareness and self accountability, and that can be really hard when you are dealing with a mental health issue, a substance abuse issue. It really feels like this kind of perfect storm
Yeah.
that's brewing. And so I would say, just to anyone who's listening, that if you are sort of on the fence about it, maybe that's kind of a telltale sign. Maybe start looking into some of those resources. And if you're questioning it, really take an honest look, with yourself deep inside yourself and think about, how maybe what you're doing, if it's impairing your practice, is it benefiting you? But those sound like fantastic resources for nurses to kind of learn more or just dive in, maybe have a self check-in like you said.
Yeah, absolutely. And I think, I speak a lot about this. And as it relates to our professional code of ethics, we like to go back to that in nursing. We are, the most trusted profession years running, right? And our code of ethics, let us not forget, like the idea of nurses helping nurses talks about us as nurses also supporting our colleagues and peers that are struggling with substance use or mental health. So be that person, be that person that is a safe person, that somebody would feel comfortable coming to you, because you're right. Sometimes we don't have enough insight, especially when we're in the thick of it. And if you surround yourself and make sure that you are that person for others, that they could come to you and say, hey, I'm struggling. Have you seen it? How can we get you
Right.
help? And maybe walk with them through this process, to have someone that is their peer or their employer or their colleague walk with them through this process helps so much decrease that fear,
Absolutely.
and anxiety that may come
Oh
with
no,
that time.
totally. Yeah. I mean, having support when going through
Yes,
something like this is just super invaluable and can really make all of the difference.
absolutely.
Well, thank you so much, Brittany, for joining me and shedding light on this really impactful program. I really, really appreciate your time and just what you guys are doing at TPAPN. It's great work.
Awesome. Thank you so much, Simone, for having us on. And, as just a closing statement, and just to let everybody know, please, if you have questions, concerns, are interested in volunteering to be a peer support partner to serve nurses, or are questioning whether that this is the right program for you or somebody that you know, please feel free. Give us a call. We are here to answer those questions, and we're here for nursing because we want our nurses to stay healthy and well and in practice. So thank you again. Thank you so much. I really appreciate it. It's been great.
And to our listeners, if you're hearing this and something hit home today, you are so not alone. There is a lot of help out there, support out there, and your career is absolutely worth protecting. Check out the links below for more information on the Texas Peer Assistance Program for Nurses, additional resources that we mentioned throughout this episode, and more. Subscribe and follow us for more information that protects your license and livelihood. And until next time, stay inspired and continue engaging and advocating with your regulatory agency.
Know Your Regulator, the podcast that inspires you to engage.